the fourth session on mastering AI basics. And today we are going to do something which we all need to do, that is using artificial intelligence as a clinical assistant for help in diagnosis and management of our patients. So what I'm going to do in the next 1 hour, this is a course, this is a 1 hour module for anybody who is a clinician, who is a doctor, who is really interested in the field of AI, who wants to use AI in their clinical practice, in their busy clinical practice, and to make a difference to their own clinical practice. So that's the whole idea of today's session. Now, as we did last time, the course is an integrated interactive course. So whatever I'm going to teach, whatever you're going to learn can also be accessed by you for the next 7 days. So for that, what you need to do is you need to go to www.technocrinology.com. The website will look something like this, and click on the free membership. On the free membership, when you click, this is something like this will open. So you can go to Integrating AI in Clinical Practice, a practical guide for healthcare professionals. This is the one which we are discussing today. There are other courses also. So those who missed the last time, if you want to access the prompting course also, you can go there. And whatever I'm going to teach is going to be present there. The video also eventually will be there. So you can revise it, access it again. There'll be certain workshops there, certain assignments for you to do. And if you finish everything, you will be able to download the certificate also from the system itself. So this is what it will look like. Right now, this is the one which we are dealing with, right? So integrating AI in clinical practice. You can also access the same thing via mobile. So you need to download an app called Thinkific app, right? So this is what it will look like, right? Go to the App Store and download the Thinkific app. Okay, and once you download the app, after that you will have to open the app. You'll have to search for Technocrinology. Okay, and when you search for Technocrinology, this yellowish thing orangish thing will open. So you can click on that. If you just need to sign up using your Google account or any other account, using your email address, and then you'll be able to access the same course via your mobile phones also. Okay, so you can go home, revise this, look at it again. There is a lot of other material also. You can look at those things as well. There are some AI applications also for you to use. So once you open and access it, this is what it will look like. And this video also eventually will go there in a couple of days as well. So you can view this video also in a few days. So let's begin with today's session. And let's start with what I call it as chapter 0. Why is chapter 0 important? Because there is a lot of confusion, there is a lot of problems with understanding AI for doctors in medicine. So in the first, I made this entire presentation, and today morning I decided that before I teach you how to use AI for your clinical clinical care, you really need to also understand why you should be doing it, why it's important to do it. Now, this is a little bell-shaped curve which I made using AI, of course. So whenever I talk to doctors, and I've been interacting with a lot of doctors across the country since the last a couple of years for AI, and whenever I talk to doctors about AI, they fall in one of these areas of the spectrum. So on the extreme end, there are people who think, oh, yeah, this is a modern snake oil, kuch nahi hai, isse kuch hone nahi wala hai. Then there are people who say that, oh, this is interesting, but it makes a lot of mistakes. Isme hallucination hota hai. This is what happens, right? So these are people who say that. And I'm going to discuss with you why AI makes mistakes. The mistakes with AI are not because of AI. It is often because of us, because we don't understand AI or we don't use it the right way. Then there are most of the people are middle of the curve. They say that, okay, let's see where it goes. I'm agnostic of this, and let's see. Then there are people who say that, oh, it's nice, it's potentially useful. And this is the place where I want most of you to be here, right? They say, okay, this is good. It's useful. I need to know how to use it, and I want to use it in my day-to-day life. And then there is another end of the spectrum also. Said, oh, this is the new God. This will replace doctors. There is nothing like this which has ever come. This is completely going to change everything. That is also one spectrum. So I don't want you to be in that spectrum also. I want you to be in the place where you say that, look, this is great, it's potentially useful, and this is how I'm going to use it. So what is it and what is it not? So what exactly is AI? So AI is a tool for augmentation. It is not a tool. It's a tool. It's not a tool which wants to replace you. It is not intended for that. It is intended to augment you, to help you. So as a lot of people in a lot of these WhatsApp groups have said that instead of calling it artificial intelligence, you should call it an augmented intelligence, right? It augments your intelligence. It helps you. So I think it's a great word. So let's call it, as Apple calls it, Apple intelligence. Let's call AI for doctors as augmented intelligence. It is very useful for cognitive specialties. For example, specialties like internal medicine, endocrinology, diabetology, rheumatology. For these specialties, it is almost inevitable that you'll have to use AI somewhere or the other. And most importantly, you should know how to use it. So proper usage is key, where you should use it and where you should not use it. And that's why today's 1 hour session is going to be, a lot of it is focused on how to use it and where to use it. What it's not, okay? One very common mistake which a lot of doctors make, and this I'm going to dispel the myth today in today's session, is that a lot of them, they start considering AI as a search engine. Okay, so it's like, sorry. They start using AI like Google. Okay, so AI is not Google. It is not a search engine. You can use it like a search engine. I'm going to tell you how. But generally, it's not a search engine. What we are basically using these days is a generative AI. It's for generating content. It is for generation. It is not for search. It can be used for search. It can be used to extract information. How you are going to do that? That is what we're going to discuss. But it's not as straightforward as you think it is. But it's not a search engine. A lot of people try to search for answers on AI and then they get disappointed by that. And so that's not something which we want to do. It's not your competitor. Okay, it's not your competitor. You don't have to prove. A lot of, again, doctors say that, oh, look, I found this information from myself and then AI used this, got this information. It's not your competitor. Okay, it's not supposed to, compete against you. You don't have to prove that it is better. You don't have to prove that you're better than AI. You are better than AI. You don't have to prove it. And most importantly, and this is something, which you need to understand, it is not a stoppable force. It's not something, it will say wish away that it will go away. It's not going to go away. It's going to be there. You need to live with it and you need to learn using it. You need to embrace it, right? So you have to embrace it. There is no other way, right? It's not stoppable. It's not something which you can say, oh, government will stop this. No, it's not going to happen. It's something which you can stop. It's already, the cat is out of the bag. You can't stop it now, right? It's already there. So it's, instead of trying to fight it, embrace it and use it for your best advantage. And that's the most important thing which you need to understand. So the technocrinology philosophy of all this is this. AI is a tool to augment your clinical skills. Let's call it augmented intelligence instead of artificial intelligence. It helps you make better diagnosis. So we are talking about cognitive specialties like endocrinology, like diabetes, like internal medicine, like rheumatology, like hematology. It helps you make better diagnosis. For all these specialties, better diagnosis is very important. It answers your clinical conundrums. Often we are stuck with a lot of clinical situations where we don't know what's the best way of going about. It reduces the time you spend on lower cognitive tasks. For example, surfing through the patient's reports and making reports, generating prescriptions, right? So a lot of lower cognitive skills also you can delegate to AI, and we'll see how we are going to do again these things in our set of presentation. So to give you some real life use cases for AI for clinicians, and that's why I wanted to give you some real case scenarios where you can use AI, so that for the rest of the lecture you can understand how you can really use it. For example, let's say you want to use it for diagnostic assistance. I'll show you the real life example here in the upcoming presentation. For example, a patient comes to you with fever and maculopapular rash, right? Maculopapular rash, and let's say you're a infectious disease specialist or an internist, and all the usual diagnostic tests, dengue, malaria, etc. are negative. And so there's a diagnostic uncertainty there. So that is where, let's say, you are stuck with a diagnosis. You want, just like writers face a writer's block, a clinician faces a clinician's block. You're stuck. You don't know where to, where you'll get your next diagnosis from. So that is where you can take a help of AI, augment your intelligence to help you get the better diagnosis, right? So this is one typical use case where you can use AI. Another use case, for example, you have a patient coming to you with ECG. Just today morning, I had a discussion with my orthopedic friend who said that, wait, orthopedics, we don't understand ECG, right? You give us ECG, we can't make heads or tails of it, right? But as specialist of internal medicine, or as cardiologists, or as endocrinologists, or as physicians, as critical care specialists, you need to understand ECG, right? But sometimes you maybe want a second opinion. You're not sure. So again, that probably the diagnosis is what you think it is, but you need an assistance of AI. So you can again use AI. Or let me give you another example. Let's say you have a retinopathy. You have a retina fundus picture. So you want a second opinion. You just want to make sure that whether the diagnosis you're making is exactly what you're thinking, right? So that is where again you can use AI. So you can use AI to augment your diagnosis. Another case scenario, for example, you're a cardiologist, right? And you generate echocardiography reports, right? So you have to type everything out. Of course, you will have a format and you will have a template, but still have to make things up, right? Type it out. So what you can do is you can make a workflow where you can simply dictate the findings. The AI can transcribe it, generate the report. This is all possible. Of course, it's a little advanced skill. So maybe you'll have to attend one of our advanced courses to learn how to do it, but it is possible to do it. Okay. So, and maybe in the next, maybe few months also, I'll not say years, within few months, you'll probably be doing this in your practice, right? So you just dictate your findings. So let's say the LVEF is 60%, there is regional wall motion abnormality, you can say diastolic dysfunction, these are things. And then you give a format, a standard format, and then it will generate the report based on that, right? So that is one way. This is a classical use of a generative AI, and this is a task which is a lower cognitive task where you can save time, right? Maybe prescription generation. Let's say you are a diabetologist and you have made certain rules, right? For example, if the patient has genitourinary tract infection, I'll not be using SGLT2 inhibitors. Or maybe you say the patient has heart failure, I'll be using SGLT2 inhibitors. So that way, you have certain rules which you have made. So you can create an AI-based workflow and to follow the rules, and so that just need to put the patient's input. We have actually made something like this called diabetology.co.in. You can go to technochronology.com, and in that go through the modules and go through the chapters. And in one of the chapters we have shown what we have made, that is diabetology.co.in, where in fact you can directly go to diabetology.co.in, where we have made this entire system where based on certain rules, the rule-based computational medicine system, where based on the clinical parameters that you put, it generates a prescription for the patient, right, for diabetes. So all these things you can do, and then you can just simply edit the prescription and give it to the patient. Maybe you're a resident doctor, right? You're preparing for morning rounds. So your senior asks certain pointed question. You know that your senior or your teacher is going to ask you, your consultant is going to ask you some questions, and you don't have time to search for the answers. So you can use Perplexity. I'm going to today's lecture. We are going to discuss a lot about Perplexity to prepare for the potential, answers to the question which your senior is going to ask you. Or maybe you are a busy family doctor, right? And patients keep sending you 30-page PDF reports, or your relatives keep sending you reports. So you can make a simple AI-based workflow where you receive the reports. AI can do the analysis. It can generate recommendations and a summary, and you can just edit that and send it over back via WhatsApp to your patient, right? So, or to your relative. So that is something, these are all potential use cases where AI can be used in your day-to-day clinical life. So when you go to technochronology.com, and to get the certificate, you will have to do certain assignments. Okay, homework to milega, right? So you will have to do this little assignment. Okay, assignment number 0. Make a document and write down 6 different ways in which you can potentially use AI in your practice. How can you use AI in your practice? You could be a cardiologist, maybe. How will you potentially use, what are the things where you waste a lot of time, right? And remember, time is money, right? So if you can save time for every patient, let's say you can save 5 minutes, look at the number of patients, you can see more patients that you can see, right? So the idea is, write 6 ways in which you can potentially use AI in your clinical practice, and then you can upload that document. Okay, so basically, if this is something which sounds interesting, it has sparked a creative idea in your mind. So take your seats. We just started the show, right? We are going to see how some of these things we are going to do in our day-to-day practice. So how you can use AI in your clinical practice, right? So again, if you're not signed up, you can go to technochronology.com, sign up, and you can see all the material, all these slides also. You can see right there, right? And you'll be able to access everything, and you can jump around, play around, and if you miss something, you can review that over there. So let's start with introduction to generative AI. What exactly is AI? Again, if you attended some of my previous, courses on the same platform, it's a repetition. So you can, but at the same time, it's always a good idea to get a little bit of revision. So what we are using these days, the Chat GPT and other things, this is what is known as generative AI. So generative AI works in this particular format. There is a prompt, that is the set of instructions that you give. There is an interface. For example, Chat GPT is an interface. There is a large language model. For example, Chat GPT uses something called GPT-4o, which is the large language model, and then it generates the output. So every generative AI follows this set of sequence. Now, there are many AI tools, but these are famous ones. So Chat GPT is famous, Perplexity is famous. We are going to discuss Perplexity today in great detail. Anthropic Claude, right, is my favorite, right? Anybody who knows me knows that Claude is my absolute favorite AI tool. Gemini is from Google, and Meta AI is from the Facebook and Meta group, right? So these are all AI tools. So the AI that you use in your WhatsApp is the Meta AI, okay? It used to be bad. I think, I used to criticize Meta AI a lot, but now it's become better. So it's now very useful, and you can directly use AI in your WhatsApp to find answers to questions and other things also. So you can actually use it like a search, right? So I'll tell you the difference in a few minutes. Okay, so for what task you can use what tool? So for general AI related generative AI task, ChatGPT is a good thing. But if you want to do AI based search or you want to do literature search, you have to use Perplexity. Always remember this. So if you want to search the internet, you have to use Perplexity. Anything that requires anything to do with Google, for example, you are answering Gmail, answering people's emails on Gmail, or you want to summarize YouTube videos, or you want to use it for search engine optimization. All these things you can use Gemini. Gemini comes from Google. Anything which requires coding, web development, etc., you can use Claude. Claude has a new model called Claude Sonnet 3.5, which is simply the best model. Anything that requires computer vision, for example, you want to use this for ECG diagnosis or clinical diagnosis, then you need what is known as computer vision, and computer vision, for that you need to use Chat GPT, which has GPT-4o computer vision. For generating images, you can use Chat GPT. There are other tools also like Stability AI, and then Chat GPT now has a new model called the O1, which is very useful for deep thinking reasoning. So if anybody has access to O1, try using it. It thinks, and it takes things step by step. And I'm going to show you an example. It is called Chain of Thought, but we have made something called Chain of Diagnosis. So if you are, again attended my previous our session with Alchem on prompt engineering, that time also we had seen this as well. Okay, so let's give you an introduction to Chat GPT and Perplexity. Again, a lot of you would already have attended these talks, so it's just a revision here. Chat GPT is basically GPT is the LLM model. Currently, the most advanced model is O1 model, which comes from the project Strawberry, which is what ChatGPT is now moving towards. It's very easy to access ChatGPT. You can go to chat.openai.com, or you can directly go to chatgpt.com. It also has a desktop application and a mobile application also, so you can download that in your system and you can use it, right? But more importantly, I would want you to use Perplexity for today's session, right? Perplexity again is a freemium tool. So a lot of it is free, but you can have as an advanced version also. So you can use a paid version as well. Paid version for Perplexity costs almost the same as ChatGPT. So if you want to use, for clinicians, I think Perplexity is more useful because we do a lot of searching and literature search. So in that case, Perplexity becomes a better tool. So again, if you want to pay for something for clinical use, I think Perplexity would be a better choice. So what is Perplexity? So Perplexity is like a Google search and ChatGPT had a child. Then it's called Perplexity. Now there are many tools being developed like Perplexity, but right now it is the leader in all this. So if let's say Google plus ChatGPT is equal to Perplexity. So Perplexity is for searching. ChatGPT is not a search engine. Perplexity is a search engine. Interestingly, the AI that you use in WhatsApp also now has the same system. So you can actually use the Meta AI also, which just like Perplexity. So it's in fact quite good now. So more on Perplexity in a few minutes, we'll discuss that. Now let's move to understanding a prompt. So like I told you, whenever you want to give set of instructions to the LLM, you need to prompt it. And this set of instructions is called prompting. Now, prompt engineering, in 2024, they actually did a survey to find which is the most important skill which people want to learn. It turns out prompt engineering is the skill which everybody wants to learn, right? Whether it's a student in school or whether it's an expert like you and me, a clinician like us, we all want to learn prompt engineering. So good prompting is very, very important for learning AI. Again, if you have not attended the previous session on prompt engineering, I insist that you do. So you go to technochronology.com, sign up for the free membership, and there you will be able to see the course on prompt engineering, which we had with Alchem last time. So you can get all the details and the video there, right? And you can access that. So I think again, I insist that if you really like to use AI, that is the course you should attend. Maybe if we can have, we are going to have more sessions, and maybe if we can come back to the prompt session as well. But here I'm just going to tell you a few things about prompting. Now, to give you a simple explanation, prompt is a set of instructions that you give to the large language model, right? Now, just like any other communication skill, the better you communicate with the large language model, the better you will get the response. This is the very important, this is the fundamental thing, right? Better, if you ask better questions, you get better answers. If you write a poor quality prompt, you will get a poor quality response. But if you write a better quality prompt, you get a better quality response. Okay. So good prompting is like good history taking. So for good clinicians, now there's a little joke, right? That when the first year resident comes and asks a patient about some information, patient will not give any answer. But when the clinician comes in the round, or when the senior and the head of the department comes in the round, or head of the unit comes in the round, the same patient is now giving answers like a parrot. Okay, so it's like that, right? So a good clinician is a master in history taking. The same way, a good clinician who uses AI is also a master in taking good answers from AI. Okay, so that is why good prompting is like good history taking. So just like history taking is a skill which all doctors are taught, prompting is also a skill which all doctors need to learn. So what is the standard format for a good prompt? So if you want to write a good prompt, these are all the few steps that you have to consider. In fact, the more better prompt you write, the more likely that you'll get, in the first shot itself, you'll get a good answer. Otherwise, you'll have to keep questioning and probably you'll get a poor quality response. So first you have to start with who am I? You have to tell the AI who you are. For example, I'll say I am an endocrinologist. Who do you want the AI to be? The persona. So you can say I am an endocrinologist. You are a research assistant. Then you have to tell specifically what is the task. So you can say that I have uploaded this PDF. I want you to summarize the PDF. So the task starts with a verb. Task has a verb in it, right? Summarize this article for me, or search for this article. Search for this information, lengthen this idea, right? Generate a presentation. So these are all verbs, right? So when you give a task, you have to give a verb. Then you have to give the context for the task. For example, summarize this PDF file that I have uploaded. Okay, so the context is the PDF file that is uploaded. Then you have to tell how you want the output to be. For example, what format you want, what size you want. So you can say I want the output in a table form, or I want the output in 300 words, right? So from format, size, etc. Then you have to write, how do you want the prompt to be in terms of tone? So I want the prompt output to be in a professional way. I want the output in a friendly way. I want this output for, what kind of audience, right? For example, I want the output, for other doctors, right? I want the output for general public. I want for output for somebody who is educated up to 10th standard. So this way, by following these rules, you can write a good prompt, and by writing a good prompt, you are able to access better data from AI. So then comes the third chapter, which is very important. How do you use AI for searching for clinical queries, right? So I promised you that we are going to discuss about using AI for day-to-day clinical work, and that's why this is where we are going to see. So we are going to discuss how you can use AI for searching answers to clinical queries. So for this purpose, which tool you should use? Do not use ChatGPT for search. Remember, ChatGPT is not a search engine. Perplexity is a search engine. Okay, so if you want to search for answers, do not use ChatGPT. Of course, ChatGPT also has a search feature. So you can actually, it connects with Bing search. So you can get answers from ChatGPT also. But it is not designed for that. It does it very poorly. And then you go and blame ChatGPT for it. So what I'll suggest is do not use ChatGPT for search purpose. For search purpose, my suggestion is that you should use Perplexity. Okay. So what tool should you use for search? So for search, you can use Perplexity. But again, if you access the course, on technology.com, we have made a tool specifically for doctors. It's called Subhash Mukhopadhyay tool. I'll tell you the name and genesis of that also. There are other apps also. There is an app called Pathway, which not many people know about, but it's a very good app. You can try it out. And there is another app by another doctor called iAnswer. You can search for these apps. These are free apps. These are available on various platforms. These are made for doctors. So again, you can use this for AI-based search or to search clinical literature for answers. So why not ChatGPT? That's the question. That's a $1 million question. That's what, whenever I start this topic, a lot of doctors come and ask me that, okay, but I have paid for ChatGPT, so why can't I use ChatGPT? The reason why you can't use ChatGPT for searching for clinical answers is that it faces a problem called the LLM problem. Now, what is LLM problem? Now, most of the large language models face the same problem. LLM has static knowledge. So, LLM only have fixed knowledge up to a cutoff date, making them potentially outdated. For example, ChatGPT is generally trained up to, let's say, April 2024. So, it has a cutoff date. It is only trained till this period. Secondly, it hallucinates. So, when it doesn't give something which is given in its training material, then it generates something of its own, because it's a generative way. It's a creative tool. It's a generative tool. So it will generate false citations, false, things, and that's why you can sometimes get problematic. So again, a lot of people have faced this problem. So it will generate false citations, right? So because it is not made for that purpose, it has limited domain knowledge, right? So LLMs, for example, it is general. It's like jack of all trades, master of none. So again, it doesn't have specific knowledge about medical knowledge. It doesn't have medical knowledge, right? So it has limited domain knowledge. It doesn't have real-time information, right? So other day, somebody asked ChatGPT about, the assassination attempt on, Trump. Now, how will ChatGPT know? It is only trained till April 2024, right? And the assassination attempt happened after that. So obviously, it's not going to know. It's not trained on that information. And then here's transparency issues. It is, hard to trace the source. So you cannot, if it gives you an answer, there is no citation for the answer. So we all, whenever you read a research article, you always want citations. You always want where does this information come from. So a ChatGPT cannot give you cannot give you the citation for it, right? So you cannot go and cross-check and cross-verify the information. So how do you solve this problem? Now the scientists who make all these AI tools, they came up with a solution, and the solution is called RAG. Okay, so RAG, you said we all use RAG in different words, right? What is RAG basically? RAG is Retrieval Augmented Generation, RAG. Okay, so what is basically RAG? Now, I told you that LLM faces a LLM problem. That is, it has static information. But what it is good at? It is good at generating information, generating and making a sense of the data which is given to us. So what people have done is made a simple system. So when you ask a question, so they made the system called Retrieval Augmented Generation. So generally, when you ask a question directly to ChatGPT, it looks at its training material and finds the answer. But when you're using a RAG system like Perplexity, what it does is you ask the question, then it first uses a search engine to search for the answer, just like a Google search or something. It will then extract all the data which is relevant to the search which you're given, and then sends the data to ChatGPT or any other large language model. So the large language model then looks at the query which you have asked, looks at the material which the search engine has looked for, and then makes sense of everything and gives you the answer, right? Another example of doing it, for example, you upload the Harrison's textbook of medicine on ChatGPT and ask ChatGPT the following prompt, that you are an expert in internal medicine. I want you to answer only based on the PDF file that I have uploaded, or the Harrison's textbook of medicine that I have uploaded. Do not answer outside this text. So then it uses the RAG system. So there is an inbuilt RAG system within all these large language models. In fact, you can actually, if you could, develop, there are other people who have developed the system where you connect Google with ChatGPT. If you can do that, you develop a system which is exactly similar to Perplexity. Okay, so it is possible to do that, right? So let's say you upload the Harrison's textbook of medicine and ask ChatGPT to only answer from Harrison's textbook of medicine, then you are using this RAG system. So what you have done is you have given a particular context, and ChatGPT is limited to answering only from that context, right? So it searches for the information in the PDF file that you have given and then answers based on the information it is found. So this is basically retrieval augmented generation. So hence, if you are using ChatGPT for medical use cases, do not use ChatGPT directly. You need to use a RAG system. Only by using a RAG system, you are able to get authentic and good answers, right? So how can you use Perplexity, which is has an inbuilt RAG system, as a clinical assistant? So this is where we'll see Perplexity. For example, you want to search for diagnostic criteria for heart failure, okay? So this is the prompt that I've written, right? It's not a great prompt. You can actually make this a better prompt, but this is just a lazy prompt that I've written, right? But you can make a better prompt. Like I said, you can always do better. So here I've written this very simple prompt. Give me the diagnostic criteria for heart failure with preserved ejection fraction. Also give me the relevant guidelines and articles that I can read on the topic. So you upload this. This is the prompt. This is what a Perplexity window looks like. Okay. So here you can see it says Perplexity. Here is where you ask the question. Here, if you have a paid version, you can use Pro Search, which is actually a better search system. But even if you're using a free system, it gives you some Pro searches for free every month. So here I just put this prompt over here. Okay. Give me the diagnostic criteria for heart failure with preserved ejection fraction. Also give relevant guidelines and articles that I can read on the topic. So then I click on search. Right now I'm using Pro Search, so you can see how it goes in terms of searching. So what it's doing is, you can see the internal system on it. Search for the diagnostic criteria of heart failure. So first it is searching. Remember, if you ask ChatGPT, it will directly go to its large language model and find the answer. But when you're using Perplexity, what does it use? It uses RAG. So it will first search for the answer, then get the data, and then feed it to the large language model, right? So it says search for diagnostic criteria, right? So it is looking for all these. What it has done is that it has taken your prompt and divided into various keywords, key terminologies, and it is looking for answers, right? So it is searching for that. Then look up for it. It is asking itself. Look up for relevant guidelines on heart failure. Then it is saying look for articles related to heart failure with preserved ejection fraction. Okay. So then it searches for the idea. It has also started listing the sources, right? So that's why here it will give you citations also. So for every answer that it gives you, it will give you citations, and you can search for the citation and you can cross verify. Okay. So answer, this is what it will say. Based on the search results on the current guidelines, here are the key diagnostic criteria for HFpEF. Diagnostic criteria for HFpEF: signs and symptoms of heart failure, LVEF more than 50%, elevated NT-proBNP or BNP, objective evidence of cardiac structural abnormalities. Then you go ahead, gives you diagnostic algorithms, etc., and everywhere it is giving you citations, right? So these are citations. So you can go and cross-check all these citations and look for the information directly. Okay. Right? So this is how a RAG system works. So again, if you want to use search, then you have to use. It is better that you use Perplexity. But again, you will say that, oh, I don't have money to spend on Perplexity. Fine. We have made this tool called the Subhash Mukhopadhyay tool. Now, for a lot of people will ask me, why Subhash Mukhopadhyay? Well, all these tools I have actually developed more than about 50-60 tools. I made so many tools for different use cases. Generally, these were for my use cases, but some of these I started putting on the websites and on our systems also for others also to use and test, right? So all these tools that I made, I at some point forgot that what was the tool called, what name I'd given to it. So that's why I started naming these tools based with giving certain names to it, right? And generally the names that I've given are generally my heroes, right? As a doctor, these people are my heroes, right? Some I read about them somewhere, or I maybe come across them somewhere, or they are somewhere I met them maybe, right? So I named all these. So whatever tools that you're going to see on technocranology.com, they'll be named after somebody, right? I have no copyrights to their names, so please excuse me for that. So Subhash Mukhopadhyay was the doctor who actually made the came up with the IVF concept of IVF, and the first test tube baby in India was result of this, called Durga. Unfortunately, he's an unsung hero. So a lot of these people are unsung heroes, right? So again, let's try to immortalize him by naming this tool after him. So we made this tool called Subhash Mukhopadhyay tool. It's basically for elite. It's an elite clinician at the core. It helps to find the right answers for the right queries. It's like basically Perplexity, but for medical use case on steroids, right? So we all know Subhash Mukhopadhyay. I already discussed this. So how do you use this tool? So again, what you do is you need to go to right. So you need to go to technochronology.com, right? And this is what it will look like. Okay, and this is the tool that we are going to use, Mastering AI Basics. Okay, and okay, so here we are here, and that is chapter 3, and here you will find the Subhash Mukhopadhyay tool, right? So this is the tool, right, which we use. So here you can ask the question, click on find literature, it will search for the relevant literature and start giving you literature with citation. So I'll give you an example here, right? So here I said, why do we see hypocalcemia in certain cases of chikungunya? Okay. So the other day we faced a patient who was having severe hypocalcemia, had chikungunya. So I just wanted to search for that, right? So yeah, so this is what we search for. So you can see the answer which it has put. Okay, so here you can see, right? Sorry. Right. Okay. So why do we see, this was the prompt that I put. Why do we see hypocalcemia in certain cases of chikungunya? Right. So you put this here, and here it starts giving the answer. So it says hypocalcemia is notable finding in some cases of chikungunya. Here are the reasons: probably muscle injury, generalized inflammation, cytokine release, direct viral effects, prevalence and clinical context, and then conclusion, and then gives the references, right, for all the answers that I give. Right. So this is basically Subhash Mukhopadhyay tool. So you can same way you can use Perplexity also for the answer. So that was the first use case, that is using AI for clinical queries or clinical conundrums. Then how about using AI for assisting in diagnosis? Now here I come with really, I think I'll say, an innovation. Okay. So when ChatGPT came up with this tool called the Owen model, they were using something called chain of thought. So they made a very simple system. They said, if AI is very good at generating things and it is very good at contextual thinking, why can't it ask questions to itself and try to answer its own questions and try to make things better? So that's why the Owen model, which is basically part of Project Strawberry, what it does is, when you ask a question, just like you saw in Perplexity is also using chain of thought. So when you ask a question to AI, it then first thinks about the steps in which it wants to do this, and then tries to find the answer. So this is called chain of thought. Now I extended this. I actually read a paper there are two people called Chen and Gui from China who wrote this paper called Chain of Diagnosis. This is not my original concept. The prompt that I've written is original, but the idea is not mine, right? So it's called Chain of Diagnosis. So they said, just like we use chain of thought, just like AI uses chain of thought, why not use chain of diagnosis to generate a diagnosis, right? So this is where they came up with the concept of chain of diagnosis. So what we did, we took the paper which this Chen and Gui had written, and we made it into something useful, which is a prompt. Okay, so that we came up with what is known as a chain of diagnosis prompt. So here we have generated a prompt which helps physicians to make the correct diagnosis. This is a most extensive and exclusive prompt. It's free of charge. So I think maybe just maybe for the goodness, it's just the first version of it. So there will be still be certain things we can iron out, but just giving it out, right? There is a complete paper also on the download section, so you can read the entire paper given by Chen and Gui. But the idea is, we made this chain of diagnosis prompt, right? So how do you can use the prompt? You can use the prompt, the entire prompt we are given. So again, I'll show you the technochronology.com. Sorry. Right. So here, okay, so this is the chain of diagnosis prompt. Okay, so this is the entire prompt. So what you have to do is just have to copy and paste this. Okay, just take this thing and just copy, right? So from here to here, you have to copy this prompt, and just here you have to give the patient information. Okay, so basically chain of diagnosis prompt is for making a diagnosis using symptoms and signs of the patient. Okay, so you have to start from the symptoms and signs, right? So I'll give you a live example of this. So just have to copy this prompt. Okay, so let's copy this prompt somewhere and put it over here. Okay, so here you have to give, this is where you have to give patient's history. Okay, so patient with fever with hypocalcemia and joint pain. Okay, so this is where I just wrote the history of this patient. Rest of the things you keep the same. Okay, don't change anything. You go there and put this in something like a ChatGPT. Okay, so just have to copy and paste this. Okay, so then it will look for the answers. Okay, just have to add this context. Just have to add this and put this over here. Okay, sorry. Yeah, it's seen now. Hello? Yeah, okay. So what we did was we just took this prompt and put it inside this thing, right? So now what it's doing is, so I have said that the patient has history of fever, hypocalcemia and joint pain. Okay, so it is now looking at potential, etiologies. So it does some diagnostic reasoning and finally comes out with questions, and it says that, what are the further tests that you need to do or further questions you need to ask, right? So the point is that you are, again, using a better prompt, trying to get a better answer, okay, based on the symptoms. So this is the chain of diagnosis prompt. Okay, there's another example here. Yeah. So, right. So here we say we have a 50-year-old male patient with diabetes complaining of pain in the right shoulder since the last 3 to 4 months. The pain is more severe on movement. What is the potential diagnosis, right? So it is then searching for the diagnosis. So it will do the symptom extraction and everything, right? So it does. Yeah. So here it says, it takes the information of the patient, does the symptom abstraction, then it goes the candidate disease recall. So what are the potential differential diagnoses? It could be frozen shoulder, it could be rotator cuff disease, it could be subacromial pain syndrome. Then it does diagnostic reasoning, why this symptom is more likely to be with this condition and so on. Then it looks at all these things, it does a self-assessment to find what is the potential differential diagnosis and gives the final diagnosis and treatment. Okay, so this is how it does in terms of the diagnostic tool. Okay, similarly, you can use it for making diagnosis of clinical image. Okay, so basically what I said is, what you have to do is you have to just use this prompt, or you can use the tool which we have developed called the Chen GUI tool. Why it's called Chen GUI? Because they are the authors of the paper. So again, you go into the system, right? And here we have this Chen GUI tool. So you can directly use this tool, right? So you can say patient with type 2 diabetes with having burning in urine, okay, with urinary, say 60 So it is searching for the answer. So it will do all the step-by-step process, right? So it will first think of the answer, right? Yeah. So here it says these things, right? So patient information, age of the patient, 60-year-old male, type 2 diabetes, burning urine, urinary hesitancy. Okay. Then it does what could be the potential diabetic, right? Diabetic nephropathy, BPH. What could be the potential things, right? Then it asks for these. These are the questions you should be asking your patients, and confidence interval and diagnosis UTI, right? This, okay, right? So that's the whole idea, right? So basically, let's say. So you can give more. So more information you give, naturally, it is going to give you better answers. Okay. So again, UTI, diabetic bladder dysfunction, side effect of SGLT2 inhibitor. Right. So what could be the potential things, and then it will say that okay, in my opinion. So these are the differential diagnosis. Then it does its diagnosis. They say that in my opinion, this is the most likely diagnosis, right? So it does a diagnostic reasoning and looks for the answer, right? So that's the whole idea of what we're doing here. Okay. Now, same way you can use for diagnosing clinical image, right? So here again we have used a similar prompt, right? So here, this is something which was posted in CME India group. So we have this patient, this maculopapular rash, 30-year-old female, no comorbidities, fever, polyarthralgia, headache, transient urticaria, mucosal ulcers, conjunctivitis. Then these are the lab reports. So what we did, we put this in the prompt, right? So we took this. We are also given the prompt for this as well. So just go there, put it in ChatGPT with the image, and then look for the answer, right? And here it again does the diagnostic reasoning, thinking, and gives the potential thing. So it could be dengue fever, it could be Zika virus, right? Why it is possible this, it could be chikungunya, right? So on and so forth, right? And then finally, based on that, says most likely diagnosis is dengue fever, right? So it basically goes by step-by-step process and tries to give you the potential diagnosis, right? So here it says final diagnosis, dengue fever, treatment plan, so on and so forth, right? Okay, so that was all in use with general medicine. What about clinical use case specifically in diabetology, right? So because I'm sure a lot of the audience is interested in diabetes management. So here we have developed another tool which is again useful. It's called the Stephen E. Kahan tool for based on the ADA 2024 guideline. Now, who is Stephen E. Kahan? Stephen Kahan is basically the author of the ADA 2024 guideline. So here we have made a simple chatbot that answers questions based on the ADA 2024 standard of care. It uses this, what we discussed, the retrieval augmented generation RAG model. It's still in early version, so there will still be bugs, right? So all these things will have bugs, right? This is all early. These are all concepts, proof of concept, right? These are not commercial tools. This is just for teaching, right? So these are all teaching. And if you find any bugs anywhere, send it to technocranology@gmail.com. Right? We'll be happy to solve that. And if you find something, I'll be happy to solve it. So these will, like I said, all these things which you have developed, all these things I have developed, they are mainly things which I developed for my own use case, which I'm sharing with you. And it's mainly for teaching purpose. It's not a commercial use purpose. It's mainly for teaching. So Stephen E. Kahan is an endocrinologist researcher specializing in diabetes. He's the chief editor-in-chief of the ADA 2024 guidelines. So naturally, we named the tool after him. So here is the tool, right? Again on the Technocranology platform. So here you can ask the question and it will answer this question based on ADA 2024 guideline. Okay. So this is how it basically works, right? It's a very simple tool, right? And easy to use. Okay. So you can try it out and again, tell me some bugs if you find, right? And like I said, still an early version of using, right? Okay, then you can use AI for helping you making a diagnosis of diabetic retinopathy. So again here, the tool you use is, you can use ChatGPT, right? And uses something called computer vision. You can see the prompt to achieve the task. So we are given the whole prompt in the, sorry, I keep closing this all the time, right? So you can see the whole prompt that we are given, and you can use the same prompt, so you don't have to use any other so this is the Stephen E. Kahan tool for the ADA 2024 guideline. Okay, and then this is the prompt for diagnostic of retinopathy. This is a prompt I have given. So you just have to copy this entire prompt, okay, and copy this and then put it in your large language model, put it on ChatGPT along with the fundus image. Okay, again, so you don't have to do any work of your own, just have to take this and put this, okay, and upload a fundus photograph. Okay, so let's take the one which you have here. Okay, so here it says you are provided with a fundus photograph of a patient diagnosed. Please perform the following tasks meticulously. Comprehensive description of findings, then all these findings, severity classification, diagnostic. So all this is there in the prompt. Okay, so you don't have to write anything. Just upload the image and copy this prompt, and okay, so it will start doing the thinking on behalf of you. So it says that there are microaneurysms, hard exudates, cotton wool spots, whether they are not, macular edema, other abnormalities. Okay. Okay. So based on that, it says it is moderate. So this is done live. Okay. I have not just did this live. Right. Again, moderate non-proliferative diabetic retinopathy. Right. So it says this is what it is. Right? Okay. And then gives you what are the recommendations you should be consider doing. Right. Immediate step, what should be doing. So all this, so in fact, this does better than all these, a lot of people pay for this fundus tools, right? This is far better than that. Just take the fundus photograph and try and find the answer to this. And I already showed you the live demonstrations, I'm not showing you the video, right? So this is what it does. This is the original image. You can try it out yourself. It's in fact correct answer. You can search in the, in the material which you are given. We are given the source to the original picture also. So you can check that out and check the description given there as well. Okay. Then another use case where diabetologists frequently use is CGM reports. So we all have patients now coming with their CGM data. So how you can use ChatGPT for or you can use Perplexity for interpreting a CGM report. Here again we have given this prompt. So what are the steps in interpretation of a CGM? So you look at the data sufficiency, look at key metrics, identify the problems, okay, which they are facing. So again, whether the patient has hypoglycemia, hyperglycemia, is there glycemic variability? Then you need to look at the problem, look at the entire ambulatory graph of the patient, identify patterns, correlate with the patient's schedule, analyze the potential causes. So look at the insulin dosing and timing, meal patterns, physical activity, other factors. Then you prioritize the issue, right? So hypoglycemia. So in terms of priority, we start with hypoglycemia is the first priority. Then look at the patient's, correct the hypoglycemia, correct the fasting hypoglycemia, then look at the postprandial hypoglycemia. This is a step. So what are the changes that you do when you interpret a CGM? You do insulin. I'm going a little fast because the idea is that you all know how to interpret CGM. I'm just telling you how to do it so that you understand how it's done by the ChatGPT based on the prompt that we have written, right? So you do insulin adjustment, meal planning. So all these things, what I'm saying is that you don't have to use a specialized tool for it. ChatGPT itself you can use. Only thing is you have to write a good prompt. That is all we need to do, right? Insulin adjustment, meal planning, lifestyle changes. Then you have to develop a action plan, set clear goals, ensure the patient understands that and implement the changes. Okay, and then you follow up the patient, make further adjustment. Right. So we have written this comprehensive prompt for doing all this. So all these things we did. Right. All you need to do yourself is basically use this prompt. Okay. Right. So this is the interpretation of CGM. Okay. So these are the steps which we discussed, and this is the prompt, right? So this is all you have to do. So just copy this prompt. Okay, just copy this prompt, and this is the sample report, okay, of patient. Right. So just upload this report. Okay. So we'll go to ChatGPT and do this. Again, you don't need to use any other special tool. You can just use ChatGPT. Okay. Go to ChatGPT. Put this sample report, or use your own report. Now, this is just a very random report. The last patient who came, I just put their data. Right, just copy and pasted this prompt. Okay, and then ChatGPT will do the rest. Okay. Okay, so here it's saying these things. So he looks at the epileptic glucose profile. So the time in range of this patient is 23%, time below range is 0, time above range is 57, so it is giving you all the data, right? Then glucose patterns it is looking at, right? What are the patterns? So persistent hyperglycemia. This patient, I'll show you the CGM of this patient. Okay, meanwhile while it's generating the answer, I'll just show you the CGM. So this is the CGM of the patient, as you can see here. So you can see that there are a lot of data inconsistencies. So there are gaps in data. So the patient is not using CGM all the time. Then you can see time in range is only 23%. So not a very good time in range. Generally the sugars are remaining high. Okay. Generally sugars are on the higher side, right? So all these things which you are looking at, right? And then it understands all this, right? And then looks at you can also put the patient's history also and the diet and everything. So if the patient has, you have collected the medications which the patient is taking, right? You can all add that as well, all that to get a better. So here it's looking at the interpretation and insights. High glucose reading. The patient has significant amount of time above the range, particularly post-meal, suggests that insulin therapy or dietary changes are necessary. High glucose variability also, right? Lack of recorded, so insulin carb data is not given. Insulin adjust. Rapid acting insulin before meals, dietary adjustment, increasing monitoring, right? So because again patient is not scanning enough. So I have this patient on Lantus 18 units. Do I need to increase the dose of the same? If yes, tell me. So I'm just putting this question. It's all live, okay? So based on the CGM data, your patient has average glucose 214 with significant percent above the range. 57% is above the range. Given the high glucose, particularly elevated reading, so it appears that the current basal dose is insufficient to maintain the glucose level. Why increase the basal dose? Because patient has persistent hyperglycemia. This. You should consider increasing by 2 to 3 units, monitoring fasting glucose over the next few days. Goal should be to average glucose close to the target range. Okay. The patient is on Fias 6 units before the E4. Also on Fias. Okay, so first it's saying why it should adjust the Fias dose, right? So it says persistent postprandial hyperglycemia. The time in target is poor, right? So increase Fias by 1 to 2 units per meal. Carbohydrate counting and insulin to carb ratio to monitor post glucose, right? Okay, caution, as with insulin adjustment, there is risk of hypoglycemia. Increasing both basal and Fias at the same time should be done with close monitoring, especially, right? And we can adjust the Fias incrementally to increase. So it's giving a reasonably good response, right? Can I, the patient has type 2 diabetes, is adding oral semaglutide a good idea for this patient? Okay, so just to give you an example of how you can actually then interpret the CGM and then you can get good responses out of it, right? Okay, so this is how you can use this for CGM as well, right? Okay, so this is what the output it gave, right? And we already discussed this, right? Okay, so basically to conclude, right, today's session, you can see all the material on technochronology.com, right? So everything is there. So if you missed out something, go and review that. First important take home message, use the right tool for the right purpose. Okay, so for general use, generative use cases, use ChatGPT, but search purpose better to use Perplexity. Remember, generative use ChatGPT, search Perplexity. Okay. Secondly, good prompt is very important, right? So good prompt should have all these features: who am I, persona, task, etc. So a well structured prompt. When you write a good prompt, you will get good response. There are some sample prompts you are all given there. You can use the same prompts, or you can generate your own, make it better. If you make a better prompt, then from the prompt course which we have done, people had submitted the assignment. Some prompts were fantastic. They're better than the prompts that I written, right? So if you use a better prompt, tell me. I'll also use it, right? So that's the thing. Remember, LLM has their own set of problems. So we need to solve this problem by using something called RAG, that is Retrieval Augmented Generation. We have developed several tools which can help you, right? Like the Subhash Mukhopadhyay tool or the Chen GUI tool. Subhash Mukhopadhyay tool is for helping you make a clinical diagnosis. So it's like, or as a clinical assistant, as you have use Perplexity. It's very good. It's little refined, so it's a good tool. But again, there might be bugs. So if there's a bug, you tell me. Chen GUI tool is for making a diagnosis based on symptoms of the patient. It uses chain of diagnosis. Then we made a Stephen E. Kahan tool, which is basically a chatbot to help clinicians answer queries based on ADA 2024 guideline. Okay, so this is it. Now, before you finish, you'll have to, to get the certificate, you'll have to pass this little exam. I'm sorry, homework bhi hoga, exam bhi hoga, right? So pass the little exam and you'll be able to get this kind of certificate, right? Which looks like this. Okay.